Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and try and make a better system for all of us by taking action. We have a lot of topics to cover today, including some really unusual medical studies. But before we get there, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which you can subscribe to for free at that link. And all of the hyperlinks to all of the medical studies and research articles and actions, everything I reference is in that newsletter, as well as lots of medical references mostly for dealing with reproductive rights, dealing with universal health care, and in case you have to fight a claim that's been denied, we have lots of resources there. Okay, so before we get into nonprofit hospitals, let me first talk about, I can't believe I'm going to do this, ivermectin. Good news, ivermectin still does not cure COVID. I cannot believe this. This was in a medical journal last week. Ivermectin is used for parasite treatments in large animals. Think about horses. Anyway, during the Trump disaster years, he actually proposed this as a cure for COVID-19. And I can't believe that anyone is still looking at it to treat COVID. But there's a link in the newsletter to get this, a Journal of the American Medical Association published an article last week. And good news, it's been shown to be ineffective in the past, and they increased the dosage to see if that would make it more effective against COVID, and a shock to nobody, the answer is no. I don't know who pays for this garbage. Anyway, go get the COVID vaccine. There's a new one out, I think this past August 2024, and you should get them regularly because the virus changes all the time. You want to make sure you're up to date. And you know what? While you're there, get a flu shot. And if your doctor or the pharmacist thinks you ought to get an RSV shot, get that too. All right, let's talk about health insurance premium increases, because this one is almost beyond belief. Annual family premiums for employer-sponsored coverage. Remember, about 90% of the population has health insurance. Of that 90%, half of them, so about 45% of the U.S. population, gets their insurance from employer plans, or about that many. Anyway, employer-sponsored coverage plans have increased, get this, 7% in price in 2024. The average cost for a family plan, $25,572. Generally, on average, workers contribute $6,296 towards the cost. This is according to the Kaiser Family Foundation's annual employer health benefits survey. It is the second year in a row that family premiums have gone up by 7%. Are you thinking of that? 2 years, a 14% increase in healthcare premiums. You know what the answer to this is. However, the Kaiser Family Foundation noted that over the past 5 years, those increases previously were mostly in step with overall inflation and wage growth. Not last year. Anyway, deductibles for single coverage held steady at, get this, $1,787, just about the same as last year. The survey also asked about the services covered by large employers with at least 200 workers. That's considered large. Small is less than 50 or less. 8% of their health plans do not cover legally provided abortions under any circumstances. 18% limit the coverage to cases for rape and incest. I wonder if you have to have a police report for that. Or when the life or health of the pregnant enrollee is at risk. I wonder how they determine what at risk is. Okay, big deep breath. Texas abortion ban consequences. This is another headline from our most regressive state. Texas new abortion laws are now stressing the state's already beleaguered OBGYN workforce and threatening the pipeline of new doctors that would help provide relief, a new survey showed. 70% of practicing OBGYNs in Texas feel that the near total ban has negatively impacted their work, prohibiting them from providing high quality, evidence-based care for their patients, according to a survey that came out last week. And there should be a link to it in the newsletter. 1 in 5, 20%, consider leaving Texas. 13% are planning to retire early. You got that? That's almost a quarter of the OBGYN workforce in Texas are ready to go. This is as a result of the new restrictions. Meanwhile, a majority of OBGYN medical residents say they're considering the new abortion laws when deciding whether to stay in Texas after their training concludes. In the summer of 2022, after the U.S. Supreme Court overturned Roe v. Wade, Texas made it a crime punishable with up to life in prison to perform an abortion. No wonder nobody's doing it. They're scared to death. There is a narrow exception to save the life of the pregnant patient, but guess what? They let them go to near death, and some states they let them die. But dozens of women have come forward in the last 2 years saying they were denied medically necessary care because of the law. Because guess what? They're scared to go to jail. Manat Health, which is a health consulting firm, surveyed all Texas-based members of the Professional Association, the American College of Obstetricians and Gynecologists. They got 400 responses from 450 practicing doctors and 47 medical residents to do this survey. A third of the OBGYNs in Texas do not have a clear understanding of the law and how it relates to their medical practice, and 60% are scared of legal repercussions. Good luck in Texas. It is not a safe place to be pregnant. This tactic has repeated itself over the past 120 years. I want you to hear this. People demanding that abortion be made difficult to obtain or illegal because not enough babies of the right sort were being born. You want to guess what right sort is? It's white and Protestant. Anyway, the answer is to keep annoying federal elected representatives until they pass the Women's Health Protection Act, restoring the right to an abortion nationwide. Because you know what? Those representatives need to think that their job is on the line unless they do this. Let's take an action. Let's annoy our U.S. representatives and senators again and again and ask that they move the Women's Health Protection Act forward. I include a link in the newsletter, and it'll be in the YouTube description box if you want to get on the phone and call them, or if you want to email them all by yourself, or use my favorite easy method, ResistBot. On your cell phone, you just send a text message to 50409, and the message is sign, S-I-G-N, space, P-L-E-G-R-F. Sign, P-L-E-G-R-F, to 50409. I'll read you the message. I'm your constituent, and I am tired of hearing about women being abused and disrespected and denied medical reproductive care that they deserve. In a new survey of OBGYNs in Texas, 60% said they're afraid to perform an abortion, even if a woman's life is in jeopardy. Enough cruelty. I don't care how you do it. You can do a discharge petition or whatever. You get the Women's Health Protection Act to a vote and restore the right to an abortion. Then implement legislation so that the Emergency Medical Treatment and Labor Act has supremacy over state shield laws, so that when a pregnant person presents in the emergency department and needs an abortion or to treat a miscarriage, they can get one. And here is a link to that survey in Texas that I mentioned, so go take care of that. Big deep breath. I want to talk about religious hospitals. I have been reviewing Catholic Health Association's tax return. I am a rocket scientist, but I'm looking at taxes. This is a lobbying organization, and we're going to talk about what they do and what nonprofit hospitals do. Along the way, once I received this tax return, I decided to see what Catholic hospitals really do and how they perform. And we're going to have a bunch of articles out covering this. This is the first. Catholic Hospitals Framework for Care Provision is based on a single document that was developed and is regularly updated by the U.S. Conference of Catholic Bishops Committee on Doctrine. I think the first year it came out was 1948. The document is called The Ethical and Religious Directives for Catholic Healthcare, and you can go read it. It's called the ERD. I have a link to it in my newsletter. It assures Catholic healthcare providers the right of refusal to provide or permit any medical procedure judged morally wrong and by the teaching authority of the Church. Doesn't that sound nice? The directives state that Catholic health institutions may not promote or condone contraceptive practices that direct sterilization, such as a hysterectomy or tubal ligation, and that abortion is never permitted. Did you hear that? It says that, never permitted, including during the interval between conception and implantation of the embryo. Now let's take a deep breath here, because that's not how it works. Let me point out that this is medically wrong. These people are just wrong and are making it up, because you're not pregnant until that embryo latches on. If it's just floating around, then it's just floating around and you ain't pregnant. That's the difference between the morning after pill, which is contraception because they have not latched on in the first 2 days, and abortion. Okay, so abortion, contraception, anything having to do with trans issues, forget it. You're just out of luck in a Catholic hospital. P.S., here's one for you in case you're my age. Death with dignity rules, forget about it. You can suffer and you can die. There is no dignity in that. Now, Catholic hospitals make a lot of money, much of it from Medicare and Medicaid. There has long been an issue with charity care and nonprofit hospitals. Let me give you a little history. Originally, about 120 years ago in the U.S., we were pretty good about charity care in hospitals. So making them tax exempt at that time, it made perfect sense, because if you couldn't pay, the hospitals were set up as charitable organizations, literally to help the poor. They could take in donations and not have to pay taxes, allegedly increasing the amount of money available to help those in need. It sounds great. You're helping those help the public. Nonprofit doesn't necessarily mean pro-poor patient. Nonprofit hospitals may provide less care to the poor than their for-profit counterparts. In fact, I've done articles on this. Nonprofits provide about 2.3% of their revenue in charity care to the poor, and for-profit hospitals, who are making a bundle of money more, they provide over 3%, closer to 3.4% of their revenue to the poor, to just pay their bills. Nonprofit hospitals charge the poor, uninsured patients more for the same services than they charge insured patients. They sometimes give their executives gold-plated compensation packages and generous perks like country club memberships. All of this calls into question whether nonprofit hospitals deserve the billions of dollars in tax breaks they receive from federal, state, and local governments. And there's a link to that there. Well, nonprofit hospitals, I mentioned this, spend about 2.3% of their revenue on charity care. For-profits at about 3.6%. I correct myself. But wait, there's more. Nonprofit hospitals' tax-exempt status, how much is that worth? That's worth 4.3% of their revenue, almost twice as much as they provide in charity care. And they're keeping the rest of the money. Got it? There was quite a clamor about this lack of visibility into the way nonprofit hospitals serve the public interest, because the IRS and most states do not require a minimum amount of spending on the poor. They require that you do something. Sometimes it's educational, sometimes it's training doctors, sometimes it's putting up billboards and saying, get a damn flu shot. You know what? Nonprofit hospitals cost the U.S. government about $26 billion a year in lost revenue, not to mention what the states lose when they grant tax exemption. Where am I going with this? Remember Catholic health associations and their tax return way back when? Well, Catholic health associations decided that its member hospitals, which is like all of them, were at risk when people decided to look into charity care. And so they decided that they needed to act and protect nonprofit hospitals. And they did it with deception masquerading as transparency. It's a good trick, but they did it. They wanted to make sure that this discussion about how much care is provided to the poor goes away and people stop looking at the benefit they provide to the community. So they helped develop Schedule H of the IRS code 501c3 for hospitals. They did, and it was implemented with the help of Chuck Grassley in 2009. The Schedule H tax exempt worksheet for hospitals you can go link to it. You can find it in the newsletter and read it. It's not very nice. It is supposed to capture community benefit spending, that's the title, and information on compliance with federal requirements for a hospital to have policies for granting financial assistance, charity care, and the process for collecting unpaid bills. You have to have processes, but you know what? It doesn't say you have to give very much money to the poor. It lists specific topics where hospitals can claim that they are serving the public. Let me share one of those with you because it's one that Catholic hospitals make a lot of use of, and it is a hoax. It is the difference between what Medicaid reimburses the hospital and what the hospital would have charged at its full inflated list price. And they claim that that is a benefit to the public. You know what? They could jack up that list price as high as they want and get as much benefit as they want, and it doesn't help the poor at all. It is fake everything. Anyway, it's very much akin, I don't know if you watch TV, but late at night they used to sell things on TV in infomercials, and they'd say, we're going to send you the dozen Ginsu knives for $49.99. But wait, don't order yet, because the better discount price is coming. And that's what this is. It is just fake pricing. Anyway, writing off the difference between your incredibly high list price at my hospital compared to what Medicaid pays, that's allegedly community benefit, instead of actually helping to pay the bills for the indigent who cannot afford to go to the hospital. Anyway, Catholic Health Associates was instrumental in this deception, and amazingly enough, they are uber proud of it. And you can go to their website and take a look at their own documentation. And because I was so angry about this, I put the link in the newsletter, and you can go read it if you can stomach it. Anyway, I want to point out that this topic was also the subject of a doctoral dissertation at the University of Chicago. I have a link to the dissertation. The title was Understanding Nonprofit Hospital Community Benefits, a Mixed Methods Approach by H. McDougall. We need reform here that makes sense. Nonprofit religious hospitals discriminate against women and others. They refuse to treat many in dire need on alleged ethical grounds, and they make a fortune doing it by paying no taxes and cheating others. Let's put this under the noses of people who are supposed to be representing us and the federal government. P.S. Regarding that CHA tax return, the Catholic Health Associates, it is a lobbying organization. If you were curious about their taxes, I'll tell you, this was, I think, for last year. They took in about $23 million a year in dues from hospitals. They got $25,000 in donations. And boys and girls, it was two donors. Two. One of them gave $5,000 and I think one gave $20,000. I mean, it was, or $15,000 and $10,000. That was all the donations. $23 million in dues. They have about $60 million in cash and stocks, bonds, and the like. They compensate their executives super well. The head of the association, she gets $1.3 million. And the top board members, they're getting in the like $300,000 to $500,000 a year. They spend yearly just about what they take in. And of that 23 or so million they take in, 13 million of it goes right back to the Catholic Church. Catholic hospitals pay a lot every year to protect themselves from government oversight. And that is the proof of it. Here's an action we can take. You can contact your elected representatives at the link that I gave you, or use ResistBot. And this one's really important to send because I don't think anybody in Congress wants to pay attention to this. And they need to, because these people are just cheating us right and left and not doing the job they're supposed to be doing in hospitals. So here's what you do. On your cell phone, you can send a text message to 50409. The message is sign, SIGN, PIAOKR. Sign space PIAOKR to 50409. I'll read you the message. I'm your constituent, and I want you to know that religious hospitals, Catholic ones in particular, are skating by with lax exemptions from federal and state governments and doing harm in the community. The harm comes from not helping women who need abortions or contraception, forcing women who want a tubal ligation after a C-section. And you know what? That's the time to do it, because it reduces the risk of a second operation. They force them to go elsewhere to get it because they won't do it. And they force them into additional risk in another surgery. What stinkers. Anyway, additionally, they make about 4.3% of their revenue from tax exemption while providing charity care of about 2.3%. We're paying these bums 2% by not charging taxes. To make matters worse, the Catholic Health Associations, a lobbying arm of Catholic hospitals, helped write Schedule H of IRS Form 990 for tax-exempt organizations to detail community benefit. They are allowed to count as benefit the difference between Medicaid reimbursement and the list price for services, which can be inflated so the benefit looks enormous, but no expense was actually taken on their part. Look, there are a lot of things to fix here, but one of them is the IRS code that has no minimum community benefit. Now, Washington State, where I live, has implemented a law that forces all hospitals to offer real assistance to anyone whose income is below a certain level. I may have misspoken. It may be just the nonprofits. You have to offer benefit to people whose income is below a level. So it doesn't specify a percent of your revenue, but it says if people are in need, you got to help them. And I got to tell you, our Attorney General, Bob Ferguson, has actually gone after Catholic hospitals and made them give the money back that they didn't give those people who needed it. Look, we need a law like that on the federal books to make them help people, because we're giving them money under the auspices that they're supposed to help them. Oh, I'm sorry for ranting like that, but this is super important. Okay, down below you can like, share, subscribe. You can send me comments here on YouTube or through Healthcare Advocacy 1@gmail.com. Any questions or comments, I'm happy to do my best to answer them for you. That's what I've got for you. Have a good evening.